It is not often that one speaks to an audience of such distinguished people. My greetings to all the doctors, the staff, the students, and the guests of the M.D. Anderson Institute. I shall be speaking on good health through spirituality, yoga, and meditation. If a lay person was asked to describe the body, she would probably describe it in terms of its parts, the hands, the feet, the legs, the head, the neck. If doctors were asked to describe the body, they would probably do it in terms of its organs, the heart, the kidneys, the liver, the pancreas, the gallbladder. If microbiologists were asked, they would tend to describe it in terms of the cells and the connecting tissues. If we asked a chemist, she would talk about atoms and molecules. And if we asked quantum physicists to describe the body, they would say it consists of vibrating patterns of energy with a whole lot of empty space between them. 99.9% empty space and vibrating energy. But this energy is receiving information from some energy source, with the help of which we are able to identify that this pattern of energy is the hydrogen atom and this pattern is the oxygen atom. These club together make a cell. The cells are also receiving energy from some divine intelligence, which is telling them how to function. A very interesting phenomenon is observed. After conception, there are one type of cells. But after a couple of weeks, these cells have changed. One knows it is to become a bone cell. One knows it is to become a liver cell. One knows it is to become a kidney cell. Where do these cells receive that information from is still a mystery. This body works in a miraculous manner. The amount of processes that take place in this body, if they were to be replicated on the outside through machines, we would probably require a plant that would be bigger than the M.D. Anderson Cancer Center. And the sound would go all the way to downtown. But all that is packed into this 5 or 6 foot frame, and it's working silently. Even doctors like yourselves need stethoscopes to find out what's going on inside. The miracle about this body is that it's created all together. We humans, we create individual parts and then we assemble them, but the body comes all assembled as a whole. And it has within itself the capacity to produce more of its kind. This body has trillions of reactions going on within it, as you are all aware. If something goes wrong, that creates disease. Disease results in misery, in suffering, in distress. That misery and suffering goes against our nature. We wish to do away with it, and that gives rise to the need for the medical profession. In the grand scheme of things, disease also has a purpose. this divine intelligence that has created this miraculous body could have easily adjusted it such that disease was much less or not at all. We see the eagle, which has such powerful eyes, flying at the height of 10,000 feet, it is able to survey which creature is moving and which has stopped moving, so possibly life has gone out of it. We see the nose of the dog, which is able to pick up a few atoms of smell. Similarly, if that was the intent of the divine intellect, the body could have just been adjusted to either reduce or eliminate disease. If disease has been permitted as a part of this scheme called the human body, it is there for a purpose. It is not the problem. It is the symptom of the problem. Like, for example, if you put your hand into the fire, two things will happen. Firstly, you will experience pain. Secondly, the hand will start burning. The pain is not a bad thing. The burning of the hand is a bad thing. If the pain did not occur, we would not know the hand is burning and we would not take it out. As we know, in the disease called leprosy, what happens is only this much, that the part becomes insensitive and hence it starts getting damaged. So similarly, disease is a symptom of something deeper. And as we go through today's discussion, I would like to explain to you that. Ayurveda divides diseases into two parts. It says some are karmaj and some are doshaj. Karmaj diseases are those that are coming from our karma. Karma, actions that we performed in the past, of which we have to reap the consequences. They are a part of our destiny. As you sow, that shall you also reap. So there is a karma that we are all carrying, and some diseases are coming by karma. The other kind of diseases are called doshaj. They are coming for various reasons, from our actions, from our lifestyle, from our eating patterns, from our working styles, from our thoughts, etc. In other words, in some way we have been involved in creating them. Now, karmaj diseases, you cannot do much about them. When that karma is burnt out, the disease will disappear. Nevertheless, we do not know which disease is doshaj and which is karmaj. Supposing somebody is ill and attributes it to one's destiny, that person will not endeavor for a cure. It's possible if he or she had tried to cure it, it may have got cured. So Ayurveda says, don't assume anything as karmaj. You endeavor. But the results are not in yours or the doctor's hands. That is why after having put in your efforts, when you get the results, be contented. So the doctor will treat, it is he who will cure. Since there's not much you can do about the karmaj diseases, let's take a look at the other ones, the doshaj diseases. So now the medical profession realizes that they can have so many causes. They can arise due to wrong eating patterns, they can arise due to excessive work, too little work, not enough exercise, too much exercise. They can also arise because of our thoughts. And that is an important point to note for our discussion today, which is the mind and the body connection. 33 decades ago, if somebody was to say that a disease is caused because of thoughts, the medical profession would have said that this is heresy, impossible. What kind of hocus pocus is being talked about? But over the last 3 decades, there has been a tremendous progress in this direction. And that is why you people have, having acknowledged this connection, invited somebody like myself to speak on this topic. So let's take a look at this mind-body connection. You all know of Pavlov's experiments where he conditioned a dog, whereby the mere ringing of a bell caused the dog to salivate. The ringing of the bell caused the mind to change its state in the dog. And the change of state caused the dog to salivate. So right here you have the mind and the body connection. We also see that people's appearances change based on their state of mind. And that is why you look at somebody and say, why are you looking so down today? The person's thought processes have impacted the appearance. Or you say, oh, you seem so jolly today. So again, the thought has a connection with the mind. If that is the case, why should there not be a similar strong and deep connection between the mind and the bodily organs? Doctors know of the placebo effect. There was a study conducted in 1950 by Dr. Stuart Wolf. He used Ipecac. Ipecac is a drug that causes vomiting. It is often kept as a precaution in laboratories just in case you happen to swallow poison and you need to vomit it out, you use Ipecac. He conducted this study on ladies who were pregnant. Now, naturally, in the first few months of pregnancy, there is the tendency to vomit. And to measure this tendency, he made them swallow little balloons so that the contraction which causes the vomiting could be actually measured. Now, when patients came to him complaining of symptoms of vomiting, Dr. Stewart gave them Ipecac. And sure enough, the vomiting increased. Then he said, now I've got a wonder drug that has just come out. It has just been tested. It has a miraculous control over vomiting, and I'm going to give this to you. And when he would give it to them, their symptoms of vomiting would vanish for the night. Next morning, again, they would reappear. So when I read this, since I'm not trained in the medical profession, I said, let me research this. What causes vomiting? And according to the notes, it is primarily caused by the brain. The brain receives varieties of signals, but it is the vomit center in the brain that causes vomiting. And hence, very naturally, there is this strong connection between the state of the mind and the tendency to vomit. So the placebo effect, the same Ipecac, when administered with this message that it's a vomit controlling drug, caused the symptoms to vanish. Another such study I came across was by dentists in London. Now, when the lower wisdom teeth are extracted, in the post-surgery, there is naturally a swelling. To control the swelling, they used to use ultrasound massaging machines from the outside. And the swelling would disappear in 30% of the cases. They did not know why is this happening. So they conducted an experiment. This time they used a machine with zero frequency waves. In other words, it just appeared to be working, but it was not emitting any vibrations. And first, it was placed at one spot on the patient. It was discovered that on 35% of the patients the swelling reduced, while in the previous case it had reduced in 30% of the cases. Then again they tried, this time the second sample set, they were moving it around. It reduced in 30% of the cases. The third time they gave it to the patient and said, you hold it. Now it reduced in 15% of the patients. But it still worked. If any of you has studied management like I did, you may have heard of the Hawthorne Effect. Do you know what is the Hawthorne Effect? You know, in production management, when about a century ago, when they were endeavoring to increase the production volume in factory lines, so they would make an adjustment. Supposing we do this for the workers, what will happen? Supposing we do this for the workers, what will happen? And they found when they made a change, the productivity increased. When they made the reverse change, the productivity still increased. And again they made a third reverse change, the productivity still increased. Then they wondered, why is this happening? And they discovered what is happening is that the workers are experiencing care. Somebody is thinking about them. Somebody is caring for them. It is that feeling that is making them produce more. So similarly, what is called the placebo effect sometimes works as remembered wellness. Placebo effect is sometimes demeaning. If you say, you got cured by the placebo effect, that person says, you mean it was all in the mind? But this can be renamed as remembered wellness. What is remembered wellness? We all remember the state of wellness. And sometimes consciously or subconsciously, we replicate that state. That is why some of you doctors may have come across this phenomenon. A patient is experiencing acute symptoms of viral throat infection. And then he or she goes to the doctor, and the doctor says, show me, and the symptoms have disappeared. Now the mere fact that the person is going to meet the doctor tells the person's subconscious that now I will be getting all right. And the remembered wellness takes place. So this connection of the state of mind with the body has a big consequence for the medical profession. How much do you reassure your patient? I came across a study where before the operation, the anesthetist behaved badly with the patient, saying, I don't know if you'll get all right or not, and I'll do my best, but I'm not so sure. And none of the other staff were aware that an experiment was being conducted. Everything else was going on perfectly. And the second group of patients, the anesthetists, behaved very nicely and very reassuringly with them. Later on, it was discovered that those with whom the anesthetist had behaved well recovered in 2.7 days earlier than the first group. So again, it is displaying the connection between the mind and the body. So there's remembered wellness, and the other side of it is remembered illness.